Good to see you this morning. Look, can you put that into context for us, where we are now to where we were in the height of the pandemic earlier this year? I mean, are we in a comparable place, do you think?
It is a little bit difficult, particularly if we're looking at cases, because of course we have a much more effective testing system now. So we have to just be a little bit careful when we're looking at cases. In terms of actual hospital admissions and deaths, sadly deaths, what we're seeing around the country is a slightly different pattern in that we're seeing much more regional variation. So the north of the country, particularly the northwest and northeast, have been very badly affected this time, and we're hearing about hospitals now struggling in terms of them being able to cope with both their COVID and non-COVID cases. Whereas if you look further south, it's not quite the same pattern, although slightly concerningly, we are seeing rates of infection increasing in the south quite quickly.
I mean, this is part of the issue, isn't it, in terms of how we digest this information? There are so many figures about, and with all the tier structure in place as well. I mean, we're hearing, there was a study from Imperial College saying that London, they believe, is about, the R rate is something like 2.86, which is higher than the rest of the country, and yet it's still only in tier 3. What do we make of these sort of figures?
Well, the R rate is a really helpful figure, but it's not the only figure to look at. So it depends on where you're starting. So the R rate tells you the rate at which the virus is increasing its transmission, so to speak. If you're starting at a low rate, if that number is high, whilst that may not be what you want, because you don't want to see the R rate increasing, it's not quite as significant as if you're starting with a higher rate of cases already, because clearly you're then talking about a much larger number of infections. So we just have to be careful that we always interpret single figures like the R rate in the context to which they're being applied.
Where do you think we are in terms of the regional structure? You talked about the regional differences that we're seeing. Is this the right way, the tier system? Do you believe this is the right way to tackle it? Because we're looking at putting people under tier restrictions for a longer period of time compared to a national lockdown for a shorter period of time. What's your assessment on what actually would be best?
Well, I think why the government's going down this route is because of this variation in what's happening across the country. And of course, we all have the concerns about people's health and their lives. I mean, ultimately, all of us want to see this virus eradicated and to reduce deaths and hospitalizations. But of course, the government's also aware of other factors, such as the economy, and also such as people's ability to sustain any level of lockdown over a protracted period. But probably the economy is one of the biggies that's driving their concern about going into lockdown across the whole country. Because clearly, if you are in places like the Northwest, then the infection is so prevalent and overwhelming, you need to do something quite dramatic, and that's what's happening in tier 3. Is it far enough? I don't know, and there are suggestions that we may need to introduce an additional tier. But if you're further down south, say southwest, where the number of infections aren't anything like what's happening in the northwest, then to ask businesses to close and risk people's livelihoods is quite a significant step. So that's why the government is wary about going into a full national lockdown just now. But will it happen? I think that is very, very likely. Because remember, we're still in October. We've got the whole of winter to go.